Now for our final speaker today, I'd like to welcome Senator Cortez Masto, a Democrat from Nevada. She sits on the influential Senate Finance Committee and helped to implement and fund 988. She also introduced, which we'll talk about, the Behavioral Health Crisis Services Expansion Act. Senator, thanks for joining us.
Thank you.
Tell us about your experience on the Finance Committee and 988 and the value of it and what do you think could be improved and maybe a little bit on your legislation.
Yeah, so first of all, thank you for this conversation. It is so important. And let me just say for folks, on Senate Finance, there's bipartisan work being done to address our mental health needs in this country. That's a good thing, right? Senator John Cornyn and I are co-chairs of a subcommittee. We've broken down into different subcommittees, and it's great to have that partnership. And that's always been the case. But let me kind of jump back. I'm a law enforcement background, so I was Attorney General for Nevada. What I saw in Nevada was this idea that we needed to bridge the gap between law enforcement and healthcare, because quite often we were seeing law enforcement were the first responders for somebody who's in acute mental health crisis, and we were just not prepared for that, right? And then there's no services in Nevada. Unfortunately, we had gotten cut mental health services in the 90s, and we never caught up. And so where were the law enforcement taking after that 911 call? They would respond. Where were they taking everyone? To the emergency room. And so we had to do something about it. And so for me, it was bringing together our law enforcement and our healthcare so that they started working together. So we started really figuring out how we get social workers and mental health workers working together. What I know from my background was that we had to get people off of that 911, right? It is not appropriate for somebody who's in acute mental health, and it's not fair to them to have them call 911 and you have law enforcement respond. We see the results of that. So it was a couple of things. So in Senate Finance, it was important for me to partner with my colleagues to, one, find this, really fund the new 988 hotline and start letting people know about it so that actually on that end, we have mental health providers that are providing acute care and support for them. But that was one piece of it. The next piece was, and this was partnering with Senator Wyden, because he has the CAHOOTS program in Oregon, mobile crisis intervention units. So when that call is made, if there is a need to send somebody out, you're not sending law enforcement, you're sending people in the mental health field to respond. So we put funding in the budget for not only the 988, but we also put funding in to create these mobile crisis intervention units across the country. Here's what I do know, and you all know this because you're in this field. It starts with the crisis mode. How do we address first that first call on the crisis side of it? How do we bring stabilization? And then how do we build out the continuum of care for mental health at all levels? We have a long way to go. For me, it was starting with that crisis side of it. Nevada's fortunate. And let me just say, before I forget, when I say bipartisan, a lot of this work has been done even before I got there with certified behavioral health centers. That was Debbie Stabenow and Roy Blunt working to put funding in for certified behavioral health centers. There were a few of them across the country. Nevada was fortunate. We had one of them. We have since put more money in to grow the certified behavioral health centers. That's part of that continuum of care. But that first call, that first interaction is the key. That's the crisis stabilization. That's the crisis mode. And that's unfortunately where a lot of people come in through that door. And we have to have services to support that. We also have to have funding sources, right? It's one thing to make the call, it's another to have funding that's going to support so many people coming around to help that individual.
And the funding plays into awareness of this because that's the battle now, is getting the education out there. And we talked on a panel earlier, like there still has to be more appropriations to let people know this is a number you can call, and it's a memorable number to call.
That's right. And so part of this is education, letting people know. But here's the thing, and this is the legislation that you talked about that I'm working on, is how do we get Medicare to fund that first 23 hours of crisis mode? That's really where I'm at right now. There should be more funding sources to help people when they come in that door. They don't have to worry about it. Medicare, Medicaid, at least from my perspective on Senate finance with Medicare, how do we get that opportunity to really help those individuals in those first 23 hours when they are in that crisis mode? Let me just give you an example. Because I'm a data person. I like to see the data. You know, we have Nevada Support, Crisis Support Center. That is actually one of, it's based in northern Nevada. It is the other end of the line when somebody calls 988, but it is also one of the national ones that picks up for calls nationally. And last year they had 87,000 calls. 37,000 were just from Nevada. And I suspect that as we get the 988 hotline out there, that is going to continue to grow. But think about this, every single one of those calls, what do we do with those individuals? Where do they go? How do we help them? What's the next step for them? And it's one thing to have the 988 hotline, but if you don't have services to put them into, what do you do? And that's where we grow this. That to me is the essential part of all of this. I have to, this is such an important issue for me. Every time I go home, I talk to folks about what we're doing in the state of Nevada. I just visited, when I was home last week, Desert Winds. It is the first residential care facility really that we have now for our kids, and they are just opening a wing for adults. And they've been open about a couple of years now. And it's fascinating to talk with them, because I will tell you the care for that, once the crisis mode and then you put them in that first kind of step of residential care, is that assessment mode. How do you identify what their needs are, right? It's evidence-based, you all know this. It's based on the individual. It's not what a textbook tells us what we should be doing. It's what those individuals need, and that's what this facility is doing for a lot of the young kids that have come through. And you know this, and you all seen this, especially after this pandemic. I can't tell you how many young people that I have talked to during the heart of the pandemic and after that have impacted mental health needs. And I remember sitting with some high school students. We were on Zoom, and I pulled a bunch of school students together throughout my state to talk to them. Let me just tell you, I now understand why we see a need across the country for so many students for mental health, just what they told me, right? Now I go to this Desert Winds, and I'm talking to a lot of the staff and the doctors there, and they're talking to me about the young folks that are coming in and the individualized care they are providing based on that need. Let me give you an example, and this is something that they talked about, so I feel comfortable to talk about it. Young woman came in, self-harming herself. How do we address this with a young person so that they're not harming themselves? How do we treat them? What they did is they gave her an apple. And they said to her, every time you feel like you need to do self-harm, peel the apple. So that she was peeling the apple and not harming herself. That was part of her care and rehabilitation. And so they are thinking ways, how do we individually focus, whether it's through that, whether it's through art, whether it's through pets and animals, whatever it is, whatever that need is. And that's what we want. That's what I want. But the challenge is we also have to grow our providers. We all know there's not enough healthcare providers for your physical care in, let me just tell you, in Nevada, let alone your mental health. And that's another piece of all of this.
When you talked to the children on that Zoom call, what struck you?
Every single one of them did. And, you know, I think this is what struck me, because as somebody who went through the public school system in my state, didn't even think about this. But after listening to them, you realize how much your schooling and going to school has an impact on your growth and your socialism and your ability to feel not isolated, but connect with others. And that social connection, that was key. And it had an impact on our students. And it had an impact on their ability, whether it's their sports or their extracurricular or their academia or just the socialism when you go in there and you're talking to students and socializing, it's a positive and it helps with their growth. And that was the number one thing that struck me amongst all of them, because that was consistent with what I was hearing from these students.
What is and I think it was great that you mentioned bipartisanship, because mental health affects Republicans, Democrats, rural, urban. And it is a bipartisan issue, and the media, I don't think, really, we kind of focus on the fight a lot of the time. But there is bipartisanship. What's the pathway for your legislation? Are you looking to attach it maybe to an appropriations vehicle or something along those lines?
Yeah, so what we've done in the past with a lot of the stuff that I've been able to pass is get it through appropriations or an omnibus or something that we can move, and we'll try to pick pieces of it and move it forward, and we'll continue to do that. I think my goal is to figure out whatever vehicle I can attach certain things to and get it done. It'd be nice, and I'm not opposed to actually having some sort of mental health legislation come out of Senate Finance. I'm still hopeful, based on the subcommittees that we've created in Senate Finance and paired up R's and D's on the various subcommittees. There's work being done in white papers that are being pushed out. I'm hopeful at some point in time we take a good chunk of those and put those into some sort of legislation as well.
You have a very busy schedule. The Senate has a large agenda before it's scheduled to go on recess. Why are you here now? Why are you talking about this? Why is this so important to you?
Because I think the more we can educate and talk about this issue, the more that we can get resources into our communities. And one final thing, let me say, this is so important. I think the more we talk about it at all levels, whether it's for our kids, whether it's for young adults, I've done a lot on first responders too, work around helping the mental health issues for our first responders. The more we talk about it and other people hear about it, we're destigmatizing it. That's the key. That's the biggest hurdle right now, is the stigma associated with receiving some sort of mental health care. I'll know we're successful when you actually can go and feel comfortable to go get physical health care or mental health care, and there's no distinction between the two. That's the other piece. One final thing, the integration of our physical and mental health. That's another piece of legislation that I have. There's funding that I have fighting for to put out there for some of our providers to help them with that first step of integrating the physical care and the mental health care within their practices. To me, that's part of that destigmatizing this mental health, because really it is about health care in general and what we should be doing to provide essential services.
Have you experienced more people willing to open up maybe post-COVID than they used to?
I think so, because I think what I see, many are realizing that at least the pandemic has had an impact, and they can cite to that and look to that to say, I need some help here. It does help when we have sports stars or stars or whoever talking about their needs as well.
That helps.
Right?
Yep.
And so I do think it is part of this discussion that we have to really still continue to focus on providing health care. And when we talk about health care, we talk about both your physical care and your mental health care.
Senate Finance has vast jurisdiction, healthcare, taxes, trade. I was saying earlier that since I've been covering Congress since 1995, this is one of the biggest success stories of government. Can you put it kind of in what your views are?
For the mental health piece
Yeah,
of it?
getting
Absolutely.
988, getting the
Listen,
bill passed pretty quickly, actually.
Yeah, let me say this. This is the first time, and you guys can check me, and you'll check me on this, but my understanding is last administrative budget, that was the first time we had seen so much money the administration had put in towards mental health. I want to say it was a 25% increase. I mean, and if you decide, and most people say, well, your budget is usually what you value. There's a value towards addressing mental health needs in this country. So that's the first step, and then more of Congress really focusing on how we push those essential resources out there. That bipartisan support behind 988 is a great statement. That we really value this idea of helping individuals and providing resources for them to reach out when they are in acute crisis or they need some sort of help for their mental health needs.
As you know, we're looking at a potential government shutdown. There's big fights over funding. We had a big bipartisan debt limit agreement, and now there are disagreements about the agreement. Do you think that Congress is going to be good in this area, because this is not a 1 year, 2 year, there's no finish line on mental health?
Yeah, that's my hope. Is what I see. I can't speak for the House side. I can speak for the Senate side. What I see is this bipartisan support continuing around the mental health, because Listen, it's not unique to Nevada what I'm seeing and I just talked about. It is happening across the country, in every community. And so if I'm seeing it, my colleagues are seeing it. And there is a need for us to work together really to provide these services that are essential for our communities.
Well, we've run out of time. Please thank the Senator for joining us. Thank you so much.
Thank you, guys. Thank you.